Previously, we opened the hidden doors of Mulago National Referral Hospital's Nuclear Medicine Laboratory, a place where radioactive drugs are prepared, handled, and safeguarded. It was here, behind the luminar flow, that Uganda's little-known nuclear scientists began their work, turning atomic particles into life-saving tools. Now, we continue this journey, stepping beyond preparation into the very heart of nuclear medicine. To guide us is Dr. Zerida, Senior Consultant in Nuclear Medicine at Mulago. With years of experience, she brings both knowledge and conviction to this rapidly evolving field.
Nuclear medicine is a subspecialty in medicine, but it uses radioisotopes, which act with a carrier, which is that radiopharmaceutical, so that it is injected in a person or it is swallowed or whatever route it is taken in, and then that carrier will help the drug to go to a particular place in the body, and we are able to get these images. I won't go into the process of the images, but we do various nuclear medicine scans. Some of the scans we do are oncology, that means the cancer patients. Then we do orthopedic, where those are the bones. We look at renal scans, that is the kidney. And then we also do the heart, and we look at the functions of the heart, if the contractility and the blood supply to the heart. We also do endocrinology, that includes the thyroid gland, the parathyroid, and I think, let me just talk about those, but we actually do the entire system.
In diagnosis, nuclear medicine is unrivaled. From detecting the spread of cancer, to assessing heart function, to uncovering hidden diseases, it provides doctors with answers at the cellular level, long before the symptoms reveal themselves.
I receive a patient with a request form. Our request forms are really detailed, and they give me the indication of what I'm supposed to look at. So that is a big guide to what I'm doing. So for example, the image before you was a renal scan. So in this renal scan, we look for various things. This patient came with hypertension, that is high blood pressure, and they thought it was because of the kidneys. So the patient was first taken to ultrasound, that is in radiology, but the kidneys looked normal. So they thought maybe it is a blood vessel, but they wanted to know what it was all about. So we came up here and we do series of images. So I will just give you some orientation of some of the images. We are looking at the back of a person. This is the human body, but the kidney, one of the kidney, is being shaped. But this side, we hardly see anything. So these images are taken at different times. So here we're able to see, because we are from the back, this is the left side, and this is the right side. So we look at the uptake of that radio tracer I told you. So you're able to see this kidney, you're not able to see the one on the right. As we continue imaging, this kidney becomes more vivid, and then later reduces, and then we start seeing something else, and that is the urinary bladder, because you know the kidney excretes. But as we are moving on, we have not seen the other kidney at all.
Is the right kidney?
It's the right kidney. So these are just enlarged images or zoomed up images showing us what we are looking for. So still in these images, it was only the left kidney which was seen, which excreted into the bladder. That shows that this left kidney can take up the radio tracer, therefore it is functioning. At the same time, it can excrete this tracer into the urinary bladder. So that's what actually it is showing. And you may wonder about these colors. So the colors, this is a grading of the colors here. So the colors show the intensity. As you go higher, that is, there's more function, or there is higher function. So that's what it shows. Another thing we look at is the function. So you look at the function of the kidneys. So the function of these kidneys, this is the left side and this is the right side. So now we get to the matrix of the kidney. So you find that the left kidney is functioning at 98%, while the right one is 2%. And what is the importance of it? The importance is to get the split function for each kidney. And this is very important for patients who are going to maybe donate kidneys. There are people who come to donate kidneys and you wonder which one to give if you are not able to do split function. So nuclear medicine really plays a big role in the function of the kidney and also giving us the split measurement of each kidney. So for this patient, in conclusion, you realize that has a non-functioning kidney, right kidney. And we know this is the right kidney and it functions by 2%. We write down our report and we send this to the clinician and they decide what to do for the patient. I talked about the cancers and I just wanted to show you the role of nuclear medicine in cancers while we are imaging and in diagnosis of the cancer patients. The cancers have increased blood flow and their cells are always multiplying. And the principal function of nuclear medicine is at a cellular level or molecular level. So it's looking at how maybe these cells are multiplying and also the flow, that's the blood flow to the tumor. So this person where we are looking for this patient is a patient who has cancer of the prostate and was referred from Cancer Institute. And we usually know that medically that cancer of the prostate spreads to the bones. But you do not go doing X-ray everywhere, maybe looking for if where it has the metastasis. So what we do what we call a whole body scan, bone scan, to look at how if cancer has spread. First of all, if it is present or it has spread. So this is, I think you can see the form of a person. And you can see the bones because this tracer it traces the bones. And I told you that where there is activity or more multiplication, increased blood flow, there will be a lot of take-up. And that's what happens where there are cancers or metastasis. So wherever you're seeing a spot, you know that there is cancer deposit. Wherever you see a spot. And we call those metastases. And these spots are called hot. We call them hot spots. So when you look at these different images, because we do anterior and posterior, that's behind, you keep on seeing that in the skull, there is something. Along the ribs, you see this? All. Even along the spines, there are those hot spots. So we are able to tell the referring clinician that our patient has metastasis. And this really guides their management of their patient. And also, especially for the spine, you're very worried about the spine because if anything breaks, then you'll be paralyzed. So we think about the quality of life for this patient. So something can be done about the metastasis.
But nuclear medicine is not only about seeing. It is also about healing. In oncology, radioactive isotopes are harnessed to deliver therapy directly to diseased tissue, shrinking tumors, easing pain, and giving patients renewed chances at life.
So nuclear medicine here, is it strictly for diagnosis, not for treatment?
No, it has the diagnostic part and the therapeutic part.
Oh,
Yes, you
okay.
can have therapy.
Okay, because I heard you talking of reports and sending back the reports. And that's why I got the impression that, are we only using it for diagnosis?
Right now, I know it does a lot of therapy. At Mulago, we do the thyroid treatment, people with thyroid treatment. And it's actually using the same basis of nuclear medicine that we would concentrate the drug. Because of the radio tracer, we would concentrate the drug within maybe the tumor. If I'm going to show you our endocrinology patients who have what we call thyrotoxicosis or goiter. So those things can be done, and it treats because it will sort of destroy the cells which have the disease. So it can be done, but we have different mandates.
Behind every innovation lies a commitment to the future. Mulago is not just treating patients today, it is also preparing the next generation of specialists.
We know certainly that you people are very few. What measures have you put in place to have other individuals really come in the event that you've probably resigned or retired and stuff like that?
That's a very good question. Actually, one of our challenges is the human resource. But whereas we appear few, the hospital and the department itself have encouraged a number of people to train in nuclear medicine. And we usually look at two departments, that is radiology as well as internal medicine. Those two departments are very critical to get other staff to work, because in nuclear medicine you just can't come straight. It is a subspecialty. So you must have had a specialty before and then subspecialize in this. So we usually look at those two because they are very critical. So we usually have students, both undergraduates and postgraduates, they make clinical rotations in this department. Then, after that, we also request people to attach to this department. But what has been very good for this department is that the administration and the International Atomic Energy Agency have done a lot and supported all the staff who are here. They keep on training and they keep on sending out like calls for people for training, like fellowships. So we have a number of people, and I want to tell you that everyone working here has trained, and because the training is, most of it is not in Uganda, the specialized training, it is outside. So people have been taken to centers of excellence and have been trained. So from the physicists to the technologists to the nuclear medicine physician to the nurse, we've all been well trained.
Yes, but given that some of these courses go for as much as, from the previous interview, as much as 30,000, that is a fortune.
Yes.
So are they scholarships, or do you people sell land out there to do those courses?
As I told you, that the government of Uganda, that is Mulago National Referral Hospital, and basically the International Atomic Energy Agency are the ones who should sponsor these courses.
Nuclear medicine often carries with it shadows of fear, images of catastrophe and radiation danger. But in reality, safety is at the very center of the practice here at Mulago.
In order to do nuclear medicine, we have guidelines. And these guidelines are international, under the International Atomic Energy Agency. So, one, what we fear most is that radioactive material. So therefore, they train. And other people working in this department are well trained. So to handle and also to dispense the stressor. So that is one. Then two, we ensure that it is safe. And the safety, you look at the infrastructure and where it is put. And if you look at the laminar flow, you just can't come and open. It looks like a cupboard, but you just can't come and open. There are a number of locks. That's where we keep the generator, which has the radio tracer. At the same time, even the doors to where we call the hot labs are almost under key and lock every time unless we are in function. And then, of course, we make sure that, like you see, I have this TLD. It's a TLD. It's to measure how much radiation I receive. And it will be after around a certain period of time, the radiation safety officer will pick it to find out how much radiation I have received. So, in terms of protection of the workers, that is another thing. Then we try to also protect the environment by giving the signs on the different, that this is the hot area, this is the cold. So everyone knows which is hot and which is cold, and we inform them how to dress up, how to even go to the for the short course convenience areas. All that we put into account. But beyond all that, we have the Atomic Energy Council in this country.
Okay.
The Atomic Energy Council regulates us. So it comes to check us and to see if everything is designed to fit nuclear medicine processes or where there is radiation dispensing. As much as I may say, I feel this is okay, we have those regulators and they are always checking on us. Maybe also what we have done with the radio, with our generators where there's the radionuclides, when we receive them at the airport, the administration requested that we have a focal person to clear, such that it's not everywhere. So a focal person clears, and we have that focal person at the airport, and we also is a person, and should be either a radio pharmacist or a nuclear medicine technology, to pick that, because he understands even where it's going to move, because you never know, you may have an accident.
Yeah, sure, that's what I was going
an
about.
Accident on the way, and that is disaster. That would be disaster. So even the routes, but because these people are trained and we have the focal people, so that's how we try to manage some of the challenges related with nuclear medicine.
Yes, doctor. Here we are so afraid of nuclear radiation. And doctor, you are injecting, you call it an isotope? You are practically injecting nuclear in this body. How safe is the patient?
The patient is very safe because we give very small doses. Very small doses. The patient is safe because we weigh the patient. We must know the weight of the patient. After knowing the weight of the patient, then we would give according to weight, the dose according to weight. And the patient is safe. And then after that, the patient will start emitting, because this drug starts decaying. So emitting off that energy, which is captured by our camera. So patients are safe, and we know how long our radio pharmaceutical, how long, or the radioisotope will take. Some take 2 hours while they are still emitting. That's called the half-life. Others take more, 4 hours. So we know, and some people we have to keep them before they leave, because we know they are still emitting radiation.
From the sterile glow of luminar flow to the healing touch in the clinic, nuclear medicine at Mulago tells a story of transformation. Here, atoms are not weapons of fear, but particles of hope, redefining diagnosis, empowering treatment, and building capacity for generations to come.